In this video, you will learn how to make changes to your company setup in the Axxess Home Health solution. To make changes in the company setup, you must have the Manage Company Information permission assigned to your user profile. To access the company setup, select the Admin tab, then Company Setup. Enter your signature, then select Proceed. Once in the company setup, the first tab is Company Information. Under this tab, you will need to review all company identifiers, such as the MPI, the Medicare provider number, and the Oasis ID code. It is also important to review location details, including the address, phone number, and fax number of your agency. Our solution can then be customized to identify your time zone. Once all changes have been made, click Save. You will then be prompted to Update Now or Update Later. Selecting Update Now will save all changes, but will return you to the main dashboard page. Select Admin, then Company Setup, enter your signature again, and proceed to continue making changes to the company setup. The next tab is the subscription plan. This will allow you to make changes to your current agreement plan. The amounts displayed reflect our current market value pricing. However, if you received a discounted price, that percentage would be reflected on your invoice. This number of patients is based on active patients in your census. As your agency grows, you have the transparency in knowing pricing for future financial planning. Once changes have been made, you will need to enter your signature password and click Submit Request. Someone from our Axxess team will receive this request and will follow up with you shortly. The next tab is the Clinical tab. The Clinical tab allows you to enable features to maintain compliance and customize certain processes for your organization. Once a feature has been enabled, it will be available to use within the home health solution. The Wound Manager is a robust management system that tracks wounds and wound orders, provides administrative access to wound history, notifications, photos, and a flow sheet documentation. The Vital Sign parameter, when enabled, will allow you to enter vital sign parameters according to your organization's protocols. Vital signs will automatically populate on Oasis and non-Oasis documents and flow into the plan of care. Any vital sign parameter that is left blank, such as a fasting blood sugar, will not flow through into the documentation. Clinicians can always edit these parameters as needed in the documents if needed still. Real-time validation. Enabling real-time validation helps add an extra layer of compliance and documentation consistency across clinical charting and Oasis assessments. This feature alerts users when a response is inconsistent with their previous response. For example, if a clinician documents that a patient is experiencing pain that interferes with activity, then the subsequent Oasis assessment question will gray out response options that contradict that. Responses indicating that the patient does not have pain or that the pain does not interfere with activity would be in gray and not available for the clinician to choose from. Bypass Quality Assurance Center. Select task below to bypass the QA Center. Any selected task will bypass the QA Center when performed by any user. Task will be identified as completed immediately upon clinician signature. Oasis Scrubber Audit Types. When an Oasis is completed, an Oasis Scrubber powered by Home Health Gold is made available. Selecting particular audit types allows you to customize what the scrubber will check for and include on the report. Hover over any eye and it will give you additional information. By utilizing this scrubber, you are alerted to inconsistent or fatal Oasis responses, documentation compliance alerts, and possible reimbursement improvement opportunities on each Oasis assessment. Plan of Care Summary is an up-to-date view of the care a patient is receiving. Enabling this feature will generate a plan of care summary in the patient chart and allow access through visit notes, so the clinicians can update patient care, including meeting various goals within the patient's chart. Additional regulatory requirements. These features can be enabled to include time entry for documentation or the inclusion of a therapist license number with their electronic signature. The next tab is a scheduling tab. Here you can customize the management of scheduling through orders-driven scheduling and authorization options. Frequency and duration warning will alert users when a visit is scheduled outside of the frequency and duration defined in the assessment and orders by displaying a warning symbol, but will still allow you to schedule. Frequency and duration compliance. When this feature is enabled, the scheduler will only be able to schedule within 7 days of the OASIS until that OASIS is completed. When enabled, you may choose from allowing the scheduler to schedule any type of visit within those 7 days or assessment and evaluations only within those 7 days. Authorization. Enabling this feature will prevent clinicians with authorization warnings from accessing the visits. This will help improve scheduling and minimize costs by eliminating unauthorized managed care visits from being charted on. Delete visits after discharge. This feature will automatically remove all scheduled visits dated after a discharge from a patient's chart once the patient is in discharge status. Auto-generate research episodes. This feature enables you to automatically generate a research episode when a patient with a scheduled research visit reaches the last 5 days of the current episode. The next tab is the Operations tab. Review Choice Demonstration. This tab contains information related to the Review Choice Demonstration, or RCD, a requirement for agencies in Illinois, Ohio, North Carolina, Texas, and Florida. If your state is participating in the RCD and has selected Pre-Claim Review as your option for review, you can enable the Pre-Claim Review Center to help you streamline your operations. By verifying and combining all required documents for submission into one file, the Pre-Claim Review Center makes it easier to receive an affirmation for each claim, track your submissions, and add the UTN to the claim. You will need to set your effective date to 30 days prior to your state effective date to include all 30-day billing periods. The next tab is the Billing tab. The Medicare week is able to be selected for a specific 7-day range that will determine the start and end day for all visit frequencies. LUPA claims recalculation. Enabling this feature will adjust all LUPA visits to reflect the visit rate calculation at the time the visits were performed on all AR reports. Therapy upcoding and downcoding is for organizations that were billing in Axxess prior to January 1st, 2020. This feature is not applicable with Medicare PDGM. Submitter information. If sending claims through Axxess, this section will already be completed for you. If you have your own submitter ID for Medicare claims, you may enter it here. Once all changes have been made, click Submit Request, then return to the company setup by going through Admin, Company Setup, enter your signature, and proceed. The next tab is the Financial tab. Under the Closed Accounting section, you have the option to lock all documents before a chosen date. This feature would require a signature from a user with the appropriate permissions to enable to edit or open any document past that date. The General Ledger report will create a series of financial and operational reports built into one Excel document. This requested report will then be retrievable in completed reports under the Reports menu. Average discipline cost per visit. This metric is used to determine whether you are operating at a gain or loss per episode of care. Select Edit, then enter an average amount including overhead cost per discipline listed, and then select Update. Once all changes are made, click Submit Request and re-enter the company setup again. Under the Payroll tab, Payroll Export Center, if enabled, the Payroll Export Center will provide you with the ability to export files to ADP or Paychex. The export file will match the components and data layout required by your payroll vendor if using ADP or Paychex. Agencies that use other payroll vendors can still edit Export Center files to their vendor specifications. If this feature is disabled, you will see the Payroll Summary under your Admin tab. Mileage Calculator. If using the Payroll Export Center, you may enable the Mileage Calculator to automatically track and calculate workers' mileage from the first patient's home to the next patient's home. This feature works with GPS and the patient's validated Google Maps address. You may also choose to include mileage to and from the worker's home on weekends. Company mileage reimbursement. You must complete this field according to your company's mileage reimbursement policy. This information will be used to calculate the mileage reimbursement amount reflected in your payroll. Click Add New and enter the affected from and to dates and the reimbursement amount. Once completed, click Save. Adding your mileage information here will default this rate to all clinicians. If you'd like to specify mileage per clinician, you can do so in their user profile under Visit Activity Pay Rates. Again, once all changes are made, click Submit Request and return to the company setup. In our Integrations tab, users with a Worldview document management subscription can enable integration between Worldview and Axxess. Approved orders will automatically get sent to Worldview to be faxed to physicians, then signed and returned back to Axxess. Orders and documents can then also be attached to patient records. You can obtain more information about your Worldview integration here. Selecting Enable will alert our client engagement team to reach out to you regarding requested additional subscription with Axxess. Support Ticketing Center. Agencies can designate up to 2 super users to directly engage with our Axxess support team and request help through the online Support Ticketing Center 24 hours a day. Other users can still call in, but only the 2 super users will receive correspondence back about the call. Under the Electronic Visit Verification tab, agencies can set up the required EVV vendor per state Medicaid and MCO providers for claim submissions. To add an EVV vendor, click on Add EVV Vendor, select your vendor, state, payers, and effective date. Once all required information is completed, click Save. Payers will only be available in the drop-down menu once you've added them as a payer within your system. Once all changes have been made, select Save and close your company setup page.